So we're glad to be starting this webinar. Thank you so much. Good evening to everyone. I'm Sandra Cobb, and I'll serve as the facilitator for this evening. And joining me from the ARTA staff, we have
Katie. I'm your social media, go-to person. So anything you see on, Facebook, Twitter, LinkedIn, that is me. Thank you for coming and participating with us today.
And we also have
Laura Simpson. I am Assistant Director of ARTA, and I will be fielding the questions tonight. I do want to be respectful of everyone's time, so any questions, we just ask that they be related to the content here today. And I want to thank Dr. Santos for being here, and for Katie and Sandra for their hard work on this.
And so for this evening, relax. You don't have to take any notes. We're going to email you the contents of the presentation later, and they'll also be available on our website at arta.org. As Laura mentioned during the presentation, there are opportunities where we're going to pause, and she'll lead us in Q&A. For this webinar, we're so honored to be joined by our special guest, Dr. Santos. Dr. Santos is a rheumatologist with a practice here in Rochester Hills, Michigan, and a great longstanding friend of ARTA. So, Dr. Santos, I believe the people are ready now to hear from you regarding the doctor-patient relationship.
Well, great. Thank you very much, Sandra. And can everyone hear me okay? Is it too loud, or this is okay?
It sounds great on our end.
Perfect. Okay, so what I want to do is, first of all, I'll just give you an outline of what we're going to talk about tonight. And I think the doctor-patient relationship is a very important discussion that we all need to have from both the physician side and the patient side. So we'll dwell on that a little bit. I want to talk a little bit about what to expect from your doctor, but also what would make it important for you to have prepared to make your visit with the doctor more meaningful and more beneficial to the patient. What can the patient do to strengthen the relationship? What can the doctor do to strengthen the relationship? How to be prepared. Certainly, just showing up is not the best way to go. I have many patients who come to see me and they don't even know why they're there. They were referred by their primary care doctor, and they tell me, I don't know why you're there, why I'm here. I think I had something abnormal, or I don't know. And so it's important to know about that. It's important, and we're going to talk a little bit about the different treatment options without being specific for specific diseases. We'll talk about autoimmune diseases and some of the important things that we have that kind of include all autoimmune diseases, talk a little bit about fatigue and diet. And I think it'll be a good introduction. Obviously, we only have an hour, so I want to make sure that we have time for questions. So if you could go on to the third slide. This is the doctor-patient relationship. It's an extremely important aspect of patient care. Much has been written about it. There's a lot of attention since the time of Hippocrates through modern times about this relationship. And we know a lot about the skills and training of doctors and what they go through. Doctors know a lot about anatomy and how the body works and disease states, how to treat diseases, but very little is really taught in medical school about bedside manner, empathy, and communication skills. So part of this talk today is going to be important for people that are involved in this relationship and that have to see a doctor on a regular basis because of autoimmune disease, that they learn what really would be important for them to get the most out of these visits. And not always the first doctor you see is going to be the best fit for you. The best doctors are knowledgeable, but they are also caring and have empathy, and they spend time with patients, and they have good staff. I've known a lot of very knowledgeable doctors who made terrible doctors when it came down to bedside manner and communicating what they were finding in this patient's exam and their diagnosis. they couldn't communicate to the patient, thereby the patient had no confidence, and really the whole setup just didn't work because patients didn't feel like they were getting the attention and the care from the doctor. In my 40 years involved in medicine, I have seen very, very knowledgeable, talented diagnosticians who really couldn't even maintain a practice because they didn't know how to treat patients. They were condescending, or they had very little time for listening to the patient. I think when we talk about a good doctor-patient relationship, you need to find a doctor who's willing to listen. And at the same time, you have to respect that the doctor's time is also important. And believe me, I'm a good listener to my patients, but we only have so much time, and you want to try to make enough time to answer all the questions, but sometimes it can certainly get overwhelming on both sides, and especially if somebody's got a very complicated case. So if you go to the next slide. So the importance of a good doctor-patient relationships. Remember, doctors are not foes. We're friends, and we really, most of us are interested in what's best for the patient. Dealing with chronic disease from the patient's side is very difficult, but it's also difficult from the doctor's side, because I don't know any doctor who knows everything. And I can tell you, in this day and age, we have a lot of activity out there, and a lot of information that's being given. We have access to a lot of different information that can help us diagnose patients, but there's a lot of misinformation out there too, and that's where I caution patients about where they're getting their information. I have a lot of patients that come in with different articles in their blogs from people that aren't physicians, so I caution you about that. Modern medicine has put a tremendous stress on the doctor-patient relationship. Why? Because physicians are more busy. We have less time. Our time is spent on things that aren't face-to-face time with the patient. We have electronic medical records where we have to, many of us, and I'm one of those that can't type very well. I have a person in the room, a scribe, typing away, and I also dictate my reports, but that takes away from the time that we need to spend with our patient, listening to their problems. The government has put a lot of stress on us because we have meaningful use, and we have to report a lot of things that, honestly, from my standpoint, are not really that important in patient care. It's more the government feels it's something important that they can document, and they keep statistics on different disease states. We have step therapy that this is a big one in my office, where patients get mad at us because we're not getting them approval for their medications when the insurance companies have their own formularies, and it's all different. You can't go by what one insurance company tells you to the next one, because some of them have certain drugs that are first line, and other ones have different drugs. And we try to do everything we can in our office to get these things done, but many times there's obvious and I think intentional delay on the insurance side not to provide these drugs right away. And many times it's taken out of the hands of the physician as to what drug is most appropriate, and we have to go with what the insurance company says is the most appropriate drug. Next slide. So it's really important in this relationship to have a good rapport with the doctor. Despite all these obstacles that I mentioned previously, the doctor-patient relationship remains one of the most important factors that will determine successful outcomes. This is where information is gathered. The doctor's talking to the patient. Trust is established, and if the patient doesn't trust the doctor, they're not going to come forth with a lot of information that may be helpful to their case. I can't tell you how many times I have a patient that comes into the office and they're not talking, and after they get comfortable, they start telling you things. And sometimes when you're about to walk out the door, they call you back and tell you the most important thing of their visit. And that sometimes gets me behind, and because you're not going to abandon somebody in that sense. But that's where it's really important to be organized when you come see the doctor. So this doctor-patient relationship is very helpful in making a diagnosis, so the doctor can hear everything that's important. Compliance is strengthened and healing, and the patient activation is accomplished. So a lot of these things really are paramount to an excellent doctor-patient relationship. A patient who doesn't trust or even like his practitioner isn't going to open up. They're not going to disclose information efficiently or completely. And it's really important for the doctor to have as much information as possible to be able to come to the right conclusion with each patient. An anxious patient is going to be reluctant to follow recommendations and find it difficult to achieve or to comprehend the instructions that the physician is giving them. So it works both ways. If the physician is short, if you can tell right off the bat that they're distracted, if they are looking at their clock and they don't have a lot of time, I think it's important to maybe find a different doctor. I can tell you that some days I'm working 11 hours in the day, and I pride myself in that my 26th or 27th patient of the day I'm dead, I treat them as if they were my first, and so I think that's important. I think more and more data suggests that a patient that is engaged in their care and that participates in their care have better outcomes. So go on to the next slide. So finding the right doctor, like other relationships, you might want to date around and find the best fit. And there's no question. Unfortunately, some insurance companies, some HMOs, they assign you a doctor, and I think in some cases it's hard to change. But I think that you need to have a good relationship with open communication, mutual respect, and trust. And we're all human. There are doctors that have great bedside manner. There are doctors that you go see them and they're smiling all the time. And then there are doctors that they're tired. Maybe they're depressed. They don't want to be there. And you have to kind of feel around for that, because if you find somebody that's not interested in your case or looks like they have other things on their mind, you're not going to get good care there. And I think that it's really important to and these doctors are out there, believe me. There's people that, and I know a lot of them, and that will listen to you. Now, again, we can't spend hours with patients, but certainly the time they're there, the doctor can show compassion and show that he really cares, and make time to try to answer as many questions as possible. I think that what makes a good doctor in my book is knowledge. Knowledge is very important, but it's not the only thing. Compassion, communication skills, accessibility. So it's not just that they're seeing you in the office. It's that they have a good setup in the office to answer questions and things like that, and also a good supportive staff, because I've had in the past really bad front office people that we had to let go, who were just antagonizing patients. And I always tell my staff that it's important for the patient to feel like they belong, and that we really care about their health, and that we're really there to help them, whatever that treatment is going to be. The courtesy level of the staff is really important. It's important to not have patients waiting for too long. And I personally hate waiting at doctor's offices myself, but some days I'll get behind an hour, and it's not because I'm, just not doing stuff related to the patient. A lot of it has to do with these electronic medical records now. And then there are patients that need more time. And so I pride myself, if somebody's in need, I'm going to spend a little bit more time with that patient. But remember, if you see a lot of people like that, then you extend the time on every patient. By the end of the day, I could be an hour behind. I think most of my patients understand that, and they don't get upset. But if you have doctors that are consistently 2 and 3 hours behind, and I know those doctors, and I know that it surprises me that patients continue to wait for that length of time. Now, a lot of them do spend a lot of time with their patients, and so the patients will wait that long. But I think if you have doctors, and I've heard incredible stories of doctors that go shopping and their patients are in the waiting room. I had a patient tell me that, and she saw him coming in with groceries, and she had been waiting for an hour. It's really important that you find the right physician that's going to care for you. A physician also, what makes a good physician is somebody who's really looking to make you feel better. I had a patient just today. She comes into the office and we're talking about her primary care, and she tells me, he's never touched me in the 5 visits because my old doctor retired. And now I have this new doctor and he's never touched me. I go, he's never touched you? How does he examine you? And she said, he sits in front of the computer and he asks me questions. I answer the questions. He types away, and then I'm done, and that's it. I'm out the door. And I said, well, you need a new doctor. How is that doctor going to figure out that somebody's got a problem? I can't tell you how many times I have patients who they have atrial fibrillation or they have something that they're not feeling, and I pick it up on the exam. So really important to have a doctor that cares. Physicians are expected and required to act in their patient's best interest. Always remember that, even when those interests conflict with their own. So I think that if you keep that in mind, you can find doctors out there, and there's many that are very compassionate and very knowledgeable and interested in helping people. Unfortunately, in this day and age, when we're moving away from private practice, a lot of doctors are now employed, and so they're getting a lot of stress from that, and there's a lot of demand for seeing more and more patients and in less and less time, and so I think that's going to be a problem that we have to solve in the future. So next slide. So I think Sandra, were you going to go to doctor referrals, or was someone going to talk about that?
Absolutely.
Small technical glitch. Just 1 second. Okay.
Which actually brings me to a comment I wanted to make. If at any time during this presentation you're unable to hear the speaker or something goes quirky with the slides, just raise your hand, please, and send us a note so that we can fix it as soon as possible. Thank you, Dr. Santos. It's interesting to me to know as a patient that physicians actually want to have a good working partnership with us. I love your point that knowledge and empathy makes for the best physician. We want to hear from some of the questions, Laura. Do we have any so far that Dr. Santos can address?
Yes, we do. The first one, and I think, Sandra, actually, you know what? I'm going to end on that one because I think it'll play nicely into the doctor referrals. So the first one, how to make different specialists treating patients to work as a team in treatment of a patient with multiple autoimmune conditions.
So I think that's a very important question, because some of the demands being put on doctors these days, it's you're seeing one patient after another, and you get patients that are very complicated, and you want to make sure that the doctors are talking together. Now, actually, the electronic medical record does help that to some degree, because after every office visit that I see a patient, I fax directly from the chart a copy of the report that I just did to whatever doctor's involved in the care. And so if somebody's got a very complicated case, we'll call and talk to the doctor personally. And I think, again, you can't force your doctor to do that. And it doesn't necessarily, you don't have to talk to every doctor involved. But I think when there's issues specifically in regards to, let's say, an organ system that's having more problems. And as a rheumatologist, for example, if I have a patient with lupus who's got kidney problems, I want to get on the phone and talk to that kidney doctor. Or if I have someone with lung problems, I want to talk to the lung doctor. But we are sending the notes electronically, at least those doctors that are electronically capable. But I think patients should demand that doctors communicate.
Wonderful, thank you. The next question, what is the best avenue to communicate your needs with a hospitalist who is not listening?
Yeah, that's a good question because it's not like you can change doctors. Although when I used to do internal medicine, I'm a rheumatologist. When I used to do internal medicine, I had frequently I was asked to see patients who had fired their a hospital doctor, and we didn't have hospitalists back then, but they fired their primary, and the administration would come to me. They knew I was, willing to work with patients who were had more difficult problems. And so they asked me to take over the care. I think what they can do is, if you have a hospitalist that you're not happy with, contact the administrator. They certainly are available to listen. And if they're not, you need to find a different hospital. But talking to the nurse and getting somebody from administration to find somebody who's going to listen to you, I think is important. And I think if the doctor is too busy to listen to your complaints, that's a problem.
Thank you. And then the last question, Sandra, this one will be for you. How to find a specialist for your illnesses?
Awesome. Great leading. You're right. That's the perfect question. So if you happen to be looking for a physician or specialist, let ARDA be your matchmaker. Just call our office and we can help you find a specialist in autoimmune disease hopefully in your target area. Just give us a call at 586-776-3900, or you can shoot us an email at AARDA, AARDA, at AARDA.org. We're waiting. We get those type of questions every day. Someone looking for a specialist. So give us a call or shoot us an email, and we'll try to be that matchmaker for you. So right now, Dr. Santos, I think we'll ask you to continue with your presentation. Okay,
sounds good. So working with your doctor, and this is really important because when you go see a specialist, especially if you have autoimmune diseases, you want to make sure that the time spent with the doctor is the most efficient time. Why I can't tell you how many times I have a patient come into the office and they have no papers, no blood work, and they're telling me, in fact, I saw one today that said, "Oh, my blood work was abnormal, and my doctor sent me here." And I asked them, "Where's your blood work?" Well, they said they were going to send it. I think patients should really take it upon themselves to make sure that whatever is needed, they can even bring it in themselves. In fact, we're going to start mandating that records not be sent, that the patient bring it in. And I know it's a little bit cumbersome. However, it really allows us to provide the best care to that patient instead of then waiting. Because what I'll do is I walk out and I get my staff, could you please get on the phone, try to contact these people and see if we can get whatever blood work it was, because that's really the most important thing that is going to determine what questions I ask and how somebody's doing and how to treat them is why were they sent there initially. So if you could have that ready, doctors have, and some of us more than others, these questionnaires, and don't take that as, okay, I just got to get through this questionnaire and fill it out fast. Really take the time to fill it out and give the doctor as much information as possible. Because we all look at that, and that's what really, even after the visit, we go back and there may be some things that we might look at as how somebody answered because a lot of us will research the patient when you're not sure exactly what's going on. We all do reading and try to come up with the best solution for patients. So you want to be prepared for the initial appointment. Go on to the next slide. So I always think that for the first visit, we always have patients come in about half an hour early, and some people don't like that and they think they're waiting, but there's a lot of behind the scenes things that go on. We're putting the information into the electronic medical records, the history. the things that people filled out. So all that's getting inputted in there so that when I'm face to face with the patient, I'm looking at all this information. So an important thing I tell my patients also is that most of us are really trying to be efficient in our time. So don't be upset if you're waiting a bit. As I said before, if you're waiting a long time repetitively, I think that's a problem. But I think being understanding, and if you find a doctor where you have to wait a bit, but when you get in there, you feel like when you walk out that all your answers or your questions were answered and that it was really a good visit, then understand the waiting a little bit. If you wait an hour and a half or 2 hours and you get in there and you're out of there in 2 minutes, that's not the doctor I would want to see. I want you guys to be organized, have the necessary records available, know your medications. Many patients come in and don't know what medications are on. And that's one of the most important things when we're trying to figure out how we're going to treat them, because there's drug interactions, there's disease states that are caused by different medications, and so that's really important. If you can have the name and contact information of referring doctors and any doctors involved in your care, in this day and age, we can look things up on the internet, and sometimes it's easy to find, but many times we can't find the doctors that are referring the patients, because most of the doctors I know, but there's certainly a lot of doctors that I haven't met, and I don't know where their offices are. So next slide.
Dr. Santos, before we move on, thank you for this information, because it's very insightful on how to make our appointments more effective. But we just wanted to share the insight that it can be very overwhelming to be on top of all this information as the patient. It's a lot to think about, it's a lot to remember, it's a lot to recall. So it's our recommendation that you find someone in your support circle to help you prepare for your initial appointment and gather all this information. And it's also great to have that same person, if possible, even assist you with your follow-up appointments. So Dr. Santos, maybe we can go on to the next slide and actually talk about now how we actually should prepare for that follow-up appointment.
Yeah, so actually one of the things as far as medications, if you have your medicines, just put them in a bag and bring them with you. I mean, that's as simple as that. If you don't have a list of your medications, if you can have someone stop by your doctor's office and just pick up a small packet of information, or you could just be proactive and call the office, your doctor's office, and say, my appointment's tomorrow, or next week, can you fax over that information today? And then call the doctor's office that you're going to go to and make sure they got the information. I know some of that is cumbersome, but cases are very complicated, and you don't want to go into an appointment that you've been waiting for 2 or 3 months, like sometimes we have people waiting, and not have the time efficiently spent because the records aren't there. So I think it can be overwhelming, and do the best you can. Obviously, if it's a major problem with you, very stressful, then maybe have someone else try to help you out. But it will help get the situation better controlled and allow us to better do our job as far as diagnosing people.
You're right.
Follow-up visits also, get there a little bit early. I mean, one of the things that kind of puts me behind is I start patients at 8 in the morning, and if the first patient doesn't get there till 8:15, I'm already 15 minutes behind because my 8:15 patient's already there. And so I think that's important. Doctors make you wait, and that's not a good thing either. But you don't want to do things to kind of extend that. I think that patients with autoimmune disease, if you want to go on to the next slide, I think is something. So remember that time is limited, and so I think if you can take notes and some people are better than others. You don't have to have a long list of things, but just your most concerning problems that are most concerning to you. Also, write down questions that you might have regarding your condition, and if you have them written down, you won't forget them, because I can't tell you, a lot of my patients, after they leave the office, they call back and say, oh, I forgot to ask this, or I forgot to ask that. And I think that just being a little organized will help you in the long run. Remember, I mean, as it says here, surviving versus thriving. You want to try to get better. You want to help yourself, make the doctor see that you're trying, because I can't tell you how many patients I have that I recommend something and they don't want to do it. I recommend something else. No, I had side effects from that. I recommend something else. No, that doesn't work. My cousin had that drug and it didn't work. And so you got to be willing to at least trust. And I think that's where trust comes in the sense that working together, because I never tell my patients, you have to do this or you have to do that. I make suggestions, and together we decide, where to go. Now, one important factor, and I think it's important for people with autoimmune disease to know, is we can't answer every question. We don't know everything that's going on with autoimmune disease patients. These patients can be very, very difficult to diagnose. They are sometimes it takes a long time for something to manifest itself enough so that we can make a definitive diagnosis. So we use a lot of diagnoses like undifferentiated connective tissue disorder, inflammatory arthritis, to describe somebody's symptoms and what's going on without definitively saying, oh, this is this condition or that condition. And so I know patients get frustrated a lot of times because we don't necessarily have the answers, but we don't always, the condition isn't always manifesting itself to the point where maybe that answer is available. I think that it's really important that if you're not getting answers, you consider second opinions. And I never have a problem with a patient going to, let's say, a tertiary center. You can go on to the next slide. And so tertiary, oh, that's the previous one. I think it's the next one. You go 2 forward. Unless it's a, yeah. But I'll just finish up here that I think that any doctor who's concerned or has a problem with someone seeking a second opinion at a major medical center, I have a problem with them. Patients come in. I just had one last week that said, "Doctor, I don't want you to be upset, but I want to go to Johns Hopkins University and talk to the rheumatology department about my condition." And I said, "Absolutely. Let me know what papers you need and any records." And I actually appreciate that. We're certainly not know-it-alls, and any doctor that thinks they're a know-it-all, it's not a doctor that I want to have. So I think you have to find a doctor who's willing to work with you that way, and that if they're not getting the answers, at least get a second opinion. Now, I also saw a patient today who was very frustrated because she'd been to the University of Michigan, she'd been to the Mayo Clinic, now she's seeing me, and I basically told her the same thing that the other places were telling her, and she was not happy about it, but there aren't necessarily answers sometimes, and her condition was a lot of pain. She had fibromyalgia type symptoms, and I think that we try to help those people as much as possible, but we don't always have a specific answer as to what disease state is going on, other than sometimes it's just myofascial pain and fibromyalgia, and that's a tough condition to treat sometimes. You can go on to the next slide, and if
Dr. Santos, this is Laura. We have had a couple of questions asking what to do when a doctor's office says that they will send copies of your records, but they keep putting the patient off. Are there any patient rights where they can insist on getting copies of the records?
Well, as far as I know, the patient records are property of the patient. In our office, and I don't want to say how every office is, but if a patient wants records, we give them to them. Obviously, you have to be understanding that the office is very busy, and sometimes we can't do it right away. But with the electronic medical records, it's not too difficult. You got to go to each page and click print, and so it should be fairly easy to do. But I think that the records are the patient's, and if there's a doctor's office that's refusing to give you records, there's the insurance commissioners, and there are places that you can complain. And I think if you're going to a certain doctor and you need records, you could call that doctor's office and tell them that, explain to them, you want to come see them, you have a lot of issues, and you want to make sure that they get your records, and maybe they can call and help expedite that.
Any more questions, Laura?
I think that's it for now. There is one more, but I think it might be answered in this next segment. And if it's not, then we'll ask it on the next round. It's about a prescribed medicine.
Okay. So I just wanted to mention that, when you're diagnosed with an autoimmune disease, it doesn't just impact the individual, but it also impacts the entire family. And ARDA has information on how to help families cope with autoimmune disease. So for this and other resources, please go to our website at arda.org to get that information. And so we'll continue with our presentation, Dr. Santos.
Okay, next slide. All right, so let's talk a little bit about being an autoimmune disease patient, because I'll tell you, autoimmune diseases are very, very complicated, as many of you know, and there are many doctors that just don't feel comfortable treating patients with autoimmune disease. They're not trained in autoimmune disease. I'm not sure if you know, when we do our residencies, there are certain core rotations that we have to do, and then there are electives. And rheumatology is one of the electives, and so you could actually finish your training with never having done a rotation in rheumatology. And same goes with endocrinology, pulmonary medicine, all the subspecialties of medicine. The resident will choose what interest they have and which way they want to go. Personally, I think every resident should rotate through rheumatology, because it's not just autoimmune diseases. It has a lot to do with arthritis and many conditions they're going to be seeing every day in the office. So when you see not just the specialist, but when you're seeing your primary care doctor, you want to make sure that they have some idea of what's going on in the autoimmune world. I can't tell you how many times I get patients referred to me because they have a positive ANA. ANA is a blood test that we use. That it's one of the criteria for diagnosing lupus, but there's no reason to do an ANA in a patient who comes in for a physical. And somebody who doesn't have any signs or symptoms of lupus comes to me referred because their ANA is positive, and it's really a waste of time. It's unsettling to the patient because they're being told they might have lupus when they have no signs or symptoms of it. I think that's an important thing to know. Make sure that your doctor at least has a good feel for when it's important to refer a patient outside of the office. So, also important that autoimmune patients frequently have overlapping symptoms that really cover many of the subspecialties of medicine. When I first see a patient in the office, I do a very complete physical. And I've had patients ask me in the past, I'm here for my arthritis. Why are you making me, get into a gown, and why are you feeling my neck and doing all this stuff? And I tell them because there are over 100 different kinds of arthritis and different things that if we're not on top of it, and if you're not familiar with what's going on with the patient, you might miss. It's not just osteoarthritis and rheumatoid arthritis. There are many, many, many different kinds of arthritis that when somebody walks in the door, it could be anything, from something very mild. And that's the thing with autoimmune disease. You could have something that's more of a nuisance. For example, patients who come to me with a positive ANA, I frequently diagnose them with Hashimoto's thyroiditis, which basically doesn't need treatment. They have antibodies against their thyroid, doesn't need treatment until the thyroid function starts to go bad, and then we basically treat it with thyroid medication. Or we could have a patient with severe vasculitis, which is inflammation of the blood vessels, that, if you don't treat them, they're going to die within a short period of time because it can be very life-threatening. So autoimmune diseases run a whole gamut of the spectrum of disease severity. Now, even individual disease states, for example, lupus. I have patients who have very mild lupus. I have patients who have very severe lupus. So just telling somebody you have lupus without explaining their condition can be a source of stress. And I think this is something to talk to your doctor and have them, give you an idea of what's going on. I can tell you that I have a lot of patients who come to me and they don't meet the criteria for lupus. These are the patients that maybe have a positive ANA and maybe they break out in a rash from the sun and have some joint pains, and so they don't meet the criteria. We call these lupus-like patients or undifferentiated connective tissue disorder. And a lot of patients get upset because they want a definitive name to their condition. And I always tell them, don't be upset if I'm giving you a milder diagnosis and I'm not coming up with a definitive diagnosis, because it might equal a better outcome and less problems down the road. And I know a lot of people are frustrated when they come in, they've seen numerous doctors and they don't have an answer to their problem. Sometimes there isn't a definitive answer, and remember, you got to work with your doctor, because sometimes it takes years for something to come out completely where we can say, okay, this is definitively this or this condition. Now, obviously, if they're more serious, actually, the more serious the condition is, the easier it is to diagnose. The milder conditions and autoimmune disease, mild a lot of times equates to severe fatigue, generalized aches and pains. And the hardest thing that I do in my office is try to treat somebody's fatigue. We try to get them to exercise and do different things, but I think we'll talk a little bit more about that at the end. So go on to the next slide. So when you have autoimmune disease, and when you have one, you're more likely, or you're at a higher risk to have other autoimmune diseases. So when that happens, you tend to see numerous specialists. So for example, I'll give you the example of a lupus patient who has kidney problems and maybe heart issues and lung problems. So they're seeing a cardiologist, a pulmonologist, the rheumatologist who's kind of coordinating all the care, and the nephrologist for the kidney. It's important for all these people to talk, and it's generally the rheumatologist who's really controlling the treatment and making sure that everything is being done correctly. Remember also that doctors don't always agree, and that's why it's important for us to communicate. I've had patients come talk to me who were told by their, for example, kidney doctor that they should do this, this, and this, and I totally disagree. I tell them, there are many ways to do things, and let me talk to that doctor and see if we can come up with something that we both agree on, and that's where communication is important. Every visit that the patient comes in, most patients that have numerous doctors, their medications change. So it's always important to make sure that, and I tell my patients, and we give them a copy of their medications when they ask for it, so that they can carry that around. I think it's important to take it to each doctor. With the electronic medical records, I found sometimes where I get copies of records from another doctor, and we share the same patient, yet the medication list is different. And you want to make sure that that's all consistent from one doctor to another. I already mentioned the tertiary center of second opinions. Go on to the next slide. So patients with autoimmune disease, can have a lot of different symptoms that could be related to a new condition, could be related to the underlying condition, could be related to the treatment that they're getting or side effects from the medication. So it's important for patients, first of all, to discuss with their doctor what to expect from their condition, but also report, and they can report this through the staff. We have a portal in our electronic medical records where patients can communicate with our office if they have an issue or a problem. And many times it's not anything important, and it's just a reassurance to the patient, make sure that they understand that there's a lot of things out there that maybe don't necessarily mean anything. But when people do have different problems, sometimes our answer to them is going to be, you know what, not sure, we got to see you back in the office. And so sometimes it'll generate another office visit. And it's not that we want to bill the insurance and see people regularly, it's that we don't want to miss the more severe problems. I think that certainly if symptoms change, you don't want to just sit on them. Some of the more problematic patients that I have are a little stoic and tend to not really be concerned about some of their symptoms. And I've had some of these people that come in and have bad kidney disease, which could have been treated earlier on. Or I have patients with severe rheumatoid arthritis who I just watch them kind of destroy their joints in front of my eyes on each visit because they don't follow advice with the treatment. So I think that all these things are important for the person to be, when they're seeing the doctor, to communicate well. And so that window of communication is important. If you're calling the doctor's office and the front staff is not passing on the message, you're not getting calls back, I think you need to look for another office and another physician. Now, if you're calling every day and, because on our side, we get some people that have a lot of concerns and we try to help them, but if they're calling every day with insignificant problems, it does become an issue, and they tend to get less attention if the issues that they're complaining about are really minor, and because we have a lot of patients who have serious problems, and you want to try to address those. We can only hire so much staff, and we want to make sure that we're at least helping as many people as we can with issues that could be threatening to their health. I'll go on to the next slide. So there's a lot of decisions that are made between the doctor and the physician. In this day and age, it's not just conventional medicine. There's alternative, holistic, natural, complementary, what's out there. And I caution patients and people with autoimmune disease to just be aware that most physicians are honest. There are some physicians that have money, more of a concern with their money than anything else, and they want to order unnecessary tests, and I think most of us are not like that. So I think that most physicians really have the best interest, financial, trying to help patients, and I think that's you can probably take that to the bank. Now, there are some unscrupulous doctors out there. Next slide. Okay, so I think we're going to stop there and take any more questions. I mean, there's a lot more that can be said, but
Dr. Santos, we want to make sure that your expertise gets out there to the people. So we're going to skip this portion right now. They can see that, go to our website. Let's continue with your presentation to respect the time.
Okay.
Okay.
Sure. So patients with autoimmune disease, one of the major issues is fatigue. And it's the hardest thing that we try to manage. And to the point is that these patients, we tell them, we want to make sure they're regulating their sleep. And sleep can be disrupted by many different, for many different reasons. Either a lot of pain, or they have, the pain wakes them up at night. Their medications aren't allowing them to sleep. They are under a lot of stress. They have different medical problems, possibly lung problems or breathing problems. So getting a good night's sleep is really paramount to feeling good and trying to reduce the fatigue. We also note that regular exercise is one of the most important ways that help you get a good night's sleep and also help with your joint pains. And I get asked frequently if with arthritis, should I be exercising? And the answer is yes, absolutely yes. And I can't tell you how many times I've heard from patients when they do some physical therapy or exercise, how much better they feel the following day, certainly if you don't overdo it. So getting off the couch, and even if you can't do a whole lot, and I have patients that have chronic pain, and I tell them, go out and do some low impact aerobic exercise, and a lot of them come back and say, I feel worse. And so I tell them, I say, well, go out and just do some stretching on a regular basis, and I guarantee in a month you'll be able to do a little bit more. But you got to program your body despite what the underlying problem is, and that's not really downplaying that they're in chronic pain and that they have a lot of other issues. It's just a matter of the less you do with your body, the less you're going to want to do in the long run. I think it's important to quit smoking. I saw a patient today who was complaining of a lot of pain and wasn't doing well, and complained about treatments and everything. And I said, well, number one, the first thing you got to do is quit smoking. Anything that I want to do to help you, you need to show me that you're willing to get better, and that's quitting smoking. There's a rheumatologist who recently retired who would give her patients 6 months time to quit smoking. If they didn't, she wouldn't see them anymore. And I'm not that radical, but I think that's a good way to put pressure on patients. So avoid excessive alcohol. I think alcohol in minor amounts is not bad for you. It's good for you in some degree, unless you're allergic to it or you're on medications where you shouldn't be on alcohol. Methotrexate is a good example, patients with autoimmune disease. Try to avoid stress. In this day and age, stress is a major problem. There's a lot going on in society today, and I think that with personal issues and at work, and stress has definitely been shown to be detrimental to patients with not just autoimmune disease, but any chronic disease in general. Now, there's more and more data on the anti-inflammatory diet, and a good example would be like the Mediterranean diet. Go on to the next slide, please. So the Mediterranean diet is based, it's a plant-based diet, and so we recommend fruits, vegetables, whole grains, legumes, nuts, olive oil, fish and seafood a couple times a week, and even red wine that contains resveratrol, which is an antioxidant that's felt to prolong life. Now, all these things, there are patients that have, for example, celiac disease, and they have to avoid the wheat products and gluten, and there are patients that may be allergic to seafood, or so this diet has to be kind of set up for individual patients. It's not all or nothing. Some patients can't drink red wine, but I think avoiding the red meats as much as possible. I think there is a lot of data suggesting that some of the nightshades, so tomatoes and the peppers and eggplants, maybe are pro-inflammatory to some degree in people with autoimmune disease. So one of the things I find it very important in my patients when they come to me that are having these autoimmune problems is to really talk about diet and make sure that they're following at least this Mediterranean or anti-inflammatory diet, or if not seriously following it, to try to get them to avoid the red meats and some of the things that we talked about. And remember, everybody's different. Everybody has different allergies, and there are foods that maybe trigger autoimmune disease in different people. There's reports of, for example, black walnuts exacerbating rheumatoid arthritis, and there's reports of some people will react to certain seafoods or nuts, and we're all different. So it's really important to individualize these diets. Next slide. And I think that's it with my presentation. I'd be happy to answer any questions, or you guys tell me where to go from here.
We're going, before we wrap up, Dr. Santos, thank you so much for an incredible webinar and sharing your expertise on a doctor-patient relationship. We do hope that we can answer one or two more questions, Laura, though, if we can at this time.
Absolutely, and there have been some good questions flowing through. If we don't have a chance to get to your questions, we will follow up with you. For the first question, Dr. Santos, I was wondering how I can get specialists to want to treat me since I have multiple autoimmune conditions, including a rare. I go to visits with copies of all my reports, doctor's info, etc., printed with a copy for them. My file is almost 2 inches thick, and I think that it scares them. I've been told that there really isn't anything that can be done for me. Do you have any advice?
Well, I can tell you that there's, as we were talking about, there's a lot of conditions that cause chronic pain, and the chronic pain can be fibromyalgia, chronic fatigue syndrome, things like that I think we're learning more and more about it, and there are specialists that deal with those conditions. I have many times I have a patient that come in with a big binder and they've seen multiple doctors and really haven't gotten much answers. Unfortunately, those are very difficult. And when I see them in the office, I try to be respectful and I have them leave the records and I go through everything. But frequently, when they've seen many doctors, they frequently end up on the second visit with me frustrated because I'm telling them the same thing that the other doctors are doing. And my suggestion to somebody like that is, at least go to one of the major centers and make sure that they're being evaluated by places that see the rare conditions. And if they're not coming up with any answers, I think then the important thing is to try to find ways to cope with what they have. As long as, usually when somebody has that big binder and they've seen numerous doctors, their condition is a lot of pain, fatigue, they don't feel well, but nothing life-threatening, because when there's something life-threatening, usually that gets taken care of. Or if there's something that is needing immunosuppressive therapy or strong medications. And so I think that those are tough, and I think that finding the right doctor sometimes is not necessarily a rheumatologist or let's say a pain doctor. And by the way, I didn't talk a lot about pain management, but we are trying to really get away from opioids and narcotics these days. And I think that they're drugs that they do help with the pain. And I would caution anybody who has chronic pain to try to stay away from that stuff, because it does help the pain, but after a while it doesn't work. And then you end up having withdrawals if you try to get off, or you have pain from the medication. I think in this country, we need to find much better ways to treat pain. But sometimes seeing a psychologist and having somebody help you deal with the chronic pain symptoms is very beneficial. I don't know how else to answer that. And I can sympathize with someone who has seen numerous doctors and they're not getting any answers, because there's a lot of people out there that we just don't know.
Okay, thank you so much, Dr. Santos. We want to respect everyone's time. It is now 6:58 p.m. Just as Laura said, just remember that we do have the questions. We will follow up with you to get you answers to your questions. We wanted to also, of course, thank you for participating this time. If you have any questions or recommendations, to shoot us an email at arda with webinar in the subject matter. Our next scheduled webinar is Thursday, November 15th at 6 p.m. The focus would be on clinical trials, and we hope you'll join us again and invite others to join us. Again, Dr. Santos, thank you for an incredible webinar. It was so insightful and so helpful. And we hope others will join us again in our next webinar. We look forward to your feedback. It's now 6:59 p.m. So we will plan on wrapping up. Thank you for listening and have a great evening.
Thank you very much.